Fortunately, in our area, the incidences following primary joint replacement are small, but they're not zero. And until we push to get to zero, we will always have, all of us have patients that have had infections. And like I'm sure most surgeons and caregivers, we always remember those patients. We don't always remember the 99% that did great. And unfortunately, a true joint infection is a disaster, both clinical, functional, social, economic disaster for patients and families. And it requires multiple surgeries, multiple treatments. Sometimes you can never eradicate an infection. So one of the lessons we've all learned, and everyone already agrees upon, is prevention. Anything we can do to prevent infections is by far the best intervention in this. What Project Joints does is then begin to build the portfolio of the evidence-based practices and research to support the changes all in one place, so that you don't have to go and look at many, many different studies, but all in one place, and you can review it and then discuss it with your peers, which is a very important part of the process of change, and engaging every constituency from patients and families to preoperative staff to nursing staff to OR staff to doctors to the floor. So you begin to bring them together so that everyone can be on the same page, and it's all right there. All the tools, all the evidence, all the science, all the stories that you can use to drive change, it's all right there. I would say probably of all the things that can happen after surgery, infections are the one disaster for everyone. The doctors, the patients, the families, and the hospitals, and the system, because the cost is huge to take care of a patient. So everyone wants to avoid it. And my experience has been, if you bring it up, you're already answering a question that patients have in the back of their mind anyway. The other part of it, I think, is very positive, is this is another way to engage patient in their own care. So we do, in the program, always try to make patients and families feel like active participants in their care. And this way of, and with the bundles that we have, it's enhancing that in the sense that we are asking patients and family members to become part of the care team in reducing surgical site infections. And it doesn't just happen before, we actually, even afterwards, the way we instruct patients on how to take care of their incisions at home, for instance, is just another part of this continuum. So it's not a question of, do patients have that question in their mind? It's, I think, a question is more, how do we address it with them collectively? And there's a lot of maybe unintended positive consequences of addressing it up front and engaging them in their care. And one of the great resources of Project Joints are the calls, in which everyone can interact and discuss not only the bigger picture of what's the evidence to support this, but the implementation, the how-to, which in the OR that is a crew that always is focused on the how-to, the implementation. So what the calls permit is that the community can come together, and an OR nurse in Seattle can talk to an OR nurse in Pittsburgh or an OR nurse in Boston and trade the how-tos, the practical parts, the very practical parts, and how did you really implement this? And how did you really do the prep? And what's the time frame? Or how did you implement the nasal swab testing? Our organization has a special preoperative teaching and testing program. Not all programs have that. It doesn't mean it can't be implemented, but you may need to go and look and experience at another site where those are done in the primary care's office, which is done. So it gives the calls give you the ability to tap into this community at every level and learn about the how-tos.